Hey, Dr. Anonymous here, and in case you didn't know, and you probably did, uh, as I record this, it is the night before the White House Healthcare Summit that is supposed to be taking place tomorrow. The president has said that is putting healthcare at the forefront of his many agenda items. And according to reports, there will be about 120 people expected to be there, and this summit is expected to follow the same format as the Financial Responsibility Summit. This report goes on. The opening session will be a breakout session for participants to discuss healthcare issues in smaller groups. This article also states the administration isn't expecting a major directive to come out of the summit rather than viewing the meeting as a chance to kick off the current debate. I don't know, I think the debate has been already going on. And if you are a physician or even anybody who works in healthcare, I encourage you to definitely pay attention to the news on Thursday, March 5th, and to see kind of what comes out of this summit, to see how the news covers this summit. But my personal opinion is the way things have been going already is, it's kind of a more of a dog and pony show. I mean, the president and the Congress are just going to drive through their agenda, whatever that is. And this kind of healthcare summit, it's probably not going to make a difference in the big picture, but you never know. It could at least start to educate people, people who may not know that much about some of the healthcare particulars that have been debated and talked about before. So definitely, if you're a physician, even if you work anywhere in the healthcare field, pay attention to the news for this healthcare summit, because this is just going to be the next leg in the debate on how healthcare reform is going to be done in this country. A lot of people are very anxious about that. I am one of them. And I've talked about on my blog before, my concerns about that, and it's not any secret. So definitely take note of the news. And especially if you're a blogger, a podcaster, I encourage you to talk about it as well. Very curious to see, well, I'm not very curious, everybody kind of knows what's going to happen, but very curious to see how this is presented to the American people, presented to the press on what the healthcare agenda is going to be out of Washington. So I encourage you to at least educate yourself, educate your patients, educate your neighbors on what is going to happen and what is theorized, or what the guess is that's going to happen, not only for this summit, but going on through the rest of this year as far as healthcare legislation. We'll talk to you later.